contraindication. She has a very good cheekbone here that you see with this Z, it's a zygoma. And all this area is okay, it's a good shape. But as you can see, there is a depression of the temple of these patients with a lot of shadows inside. And I mark on this patient on the left side, and I will do the injection on the right side, all the anatomical points that Jonathan developed in the cadaver lab. So as you can see, you see the temporal crest here, that is the upper limit of this area. Then you see here the orbit, and you see here the zygomatic bone. And for me, it's a very easy area to inject because you can see very well, and this is one of the only parts of the face where you can palpate the danger. It means if you put your fingers above, this area, you can feel the temporal artery superficially, as you can feel for the mandibular line, the facial artery. So these two areas are good areas to know where is the real dangers and safety first. So I draw always the danger here. If we are looking to this patient, you can see that the depression, is mainly in one point here. This is the most concave point of her depression. And there is two options to treat this patient. The first option will be to be in the superficial injection, as Jonathan showed you. But for this, and use it, I will use, in this case, this kind of cannula. I use a soft field cannula, and I will use a very soft product, and I use RH2 if I need a superficial injection. Because like this, because of the softness of the products that spread everywhere, you will not feel any bump. This is the issue when you do a superficial injection in the temple, because the skin is very thin, and so if you are doing a superficial injection here and you put a high cohesive product, then you will have the risk to feel or see some bumps here around this area. So my advice will be to use a product, that you can spread and do a nice massage just to have a good shape in this area. Also, if you do something in the superficial area, I use always an anterior point and not in the hairline, just to avoid, to touch the hair. But my favorite, injection in this area is what I described and published in 2008. It's the gunshot technique. The gunshot technique, it's a deep bolus injection in the most concave point of this area here, deep to the bone, sliding a little bit. There is a recent article published in PRS showed that if you slide a little bit, the bevel of the needle will be immediately above the periosteum, so it will not reach any vessels. So it's a brilliant, anatomical study published. And then I will be perpendicular to my temple. It's a very safe, injection. And after, you have to do not a strong massage, because the muscle that will be above your product will give a massage, and it's for that during the 2 days after this injection, your patient, when she will eat or chew, she will feel a little pain when you do a deep bolus injection in this area. This is for the techniques. And last,
Patrick,
for the product.
Patrick?
Yes?
And then, what is the characteristic of the product that you choose?
Yes.
If you inject deeply?
If I inject deeply, because I want to lift all this area, and because I will be under the temporalis muscle, that is a very strong muscle, I need a product with high cohesive properties. So I will use the highest lifting capacity product on the market, and I will use Ultra Deep. And also, the little trick is that if you use the needle that normally you have in the blister for all the products, it's a 13 millimeters length needle. And for the temple, sometimes the 13 millimeters length needle is not long enough to reach the bone. And if you don't reach the bone and if you inject, you will inject in the muscle. And this could be painful, this could give bleedings. And we got now in our trauma center some patients with abscess after injection of fillers in this area because they developed an hematoma here because the injections were not deep enough. So I will use for this patient, and I will do it on the other side. So you will keep this anatomical, drawings on this side, and I will go on the other side, and I will do my injection where I put the cross, and this point is the most concave point of this area. Do you have any question regarding this area, the temporal area?